Good afternoon, everyone, and welcome to this webinar on the links between mental health, safety and confidential reporting. We're very pleased to welcome Amy Skelly-Burgess and Chris Langer today to deliver this session. Before I hand you over to them, I just wanted to mention a few things. Firstly, for those of you who haven't attended one of our IOSH webinars, I'm Ben Pollard and I take care of the technical aspect of these sessions. So any problems, and I shall try to assist as best as I can. On your screen, most likely located at the top left-hand side, you will notice a small bar with some written options on them. These are chat and Q&A. If you do have any technical issues and need to message me at all, please use the chat option. If you have any specific questions for our speakers about the presentation, please click on the Q&A option and ask your questions here. You can open and minimize these boxes at your own leisure. Should a message come through, it will flash orange. So I'm going to stop rambling now and hand you over to the people you've logged on to hear from, and that's Amy and Chris. I hope you all enjoy the session.
Hi everyone, so my name's Amy Skelly-Burgess and I'm here with my colleague Chris Langer. Chris is the Scheme Intelligence Manager for CIRAS and I am a data analyst for CIRAS. So many of you may know CIRAS is the confidential incident reporting system and we work in the transport industry. So our background has been in rail, we deal with health and safety concerns in the rail industry and we've recently branched out into other transport modes. So we've got a really successful scheme going at the moment with the bus industry in London, and we are developing further. You may know it was World Mental Health Day last week on the 10th of October. This is something that we've been doing a lot of work in CIRAS, so we thought this is the perfect time to broaden our channels and discuss this a bit further. Okay, so just to tell you a bit about our backgrounds. So Chris is our Scheme Intelligence Manager, like I said. He's got a Master's in Occupational Psychology. Chris specialises in human factors. He's a trained counsellor and he's also recently been trained in mindfulness. So he's got a lot of experience in this topic. I did my degree in Communications and Media Studies. I'm here on behalf of the Railway Group for IOSH as well, and I'm actually a tech member of IOSH. I'm NEBOSH qualified. I did my certificate last year. So I'm going to pass you over to Chris now.
Hello, we've got 107 participants today, so thank you very much for joining us. Very good to have you with us. Just to set out what our agenda is today, what we're going to talk about is what happens if we don't attend to mental health issues in the workplace, some of the tragic consequences if we don't do that. We're also going to set the scene with some statistics, put mental health in context. It's obviously a huge issue. It's bigger than just the workplace. And we're also going to talk about the link, a very clear link, in fact, between mental health and what surfaces in our confidential reports. We aim to make it pretty useful as well. So we've got some advice on coping with stress, and also the recent use of mindfulness for improved performance and really to combat stress, anxiety and depression, all of which can affect us in the workplace. So just to start you off with a definition of mental health, actually a couple of definitions of mental health. It's always good to set this in a bit of context. When we talk about health in general, we're saying here, as the World Health Organization does it, health is a state of complete physical, mental and social well-being, and not merely the absence of disease and infirmity. So if we think about health in a global sense like that, it's obviously more than just mental health. Mental health is a big part of it as well, though, for obvious reasons. Another definition for you here, which is quite encompassing. I like this definition because it explains a bit more about some of the factors that go into mental health. So mental health includes our emotional, psychological and social well-being. It affects how we think, feel and act. It also determines how we handle stress, relate to others, and crucially how we make choices. So that's the definition that comes from the US Department of Health and Human Sciences. Now, in terms of what happens if we get mental health wrong in the workplace and we leave people unsupported or our employees don't feel like they can reach out and get the help they need, Germanwings 9525 is a very, very good example of some of the tragic consequences that can happen if things go wrong in this regard. So just for those of you who may not be familiar with all the details, this accident involved 27-year-old Andreas Lubitz, who actually locked himself in the cabin of 9525, and he committed suicide, taking all 144 passengers and 6 crew with him. He actually had a history of mental illness, and at the time of the accident, at the time of his suicide, he was suffering psychotic symptoms, all of which he'd actually been able to hide from the authorities and from his employer. And so the accident report into this tragic accident actually described the ultimate cause as a distressed individual no longer in touch with reality. Obviously, it got to the point where no one was able to help him, and he wasn't able to convey that in any way to his employer, and he was allowed to continue in his line of duty. So really what this brings out is how we can actually reduce the stigma attached to mental illness in the workplace. And obviously not just in the airline industry, but in all industries. But obviously here we're thinking about the rail industry in particular. Are there lessons that we could learn from Germanwings 9525? One individual who is not able to convey that distress, who doesn't get the support that they need, who continues in their work, is a huge risk to public safety. So there are huge lessons to learn. There's more on this if you're interested. The slide where it's going to be made available, but you can see in the right there, the right corner, there's an article that I've written about that, and the link to that article is there. It was published in Rail Technology magazine for those who would like to follow that up. So just to set out some mental health statistics and put this in a bit of context for you to hopefully illustrate how big an issue this actually is. These statistics actually come from IOSH magazine. This was an article that actually came out last week reporting on the effects of stress at work. And these figures actually come from a trade union congress study. So one of the key statistics there, 70% of safety reps who were interviewed here actually cited stress as their main concern to workers. Other concerns that also were flagged up here: bullying and harassment over work, back strains, long hours at work. Now, if there are safety consequences to those, as there often are, those issues are reportable to CIRAS. And in fact, we do actually receive lots of reports on those issues there. Not the bullying and harassment, because that involves individuals and we don't take reports on that, but all those other topic areas there, if they have an effect on safety consequences, we can take those as reports. Working hours, long working hours, in this particular study, this was a main worry for 30%, and interestingly, that had gone up from 26% in 2014. This is also something we frequently take as reports at CIRAS, people talking about the long travel times to a work site, perhaps being on a site 10, 12 hours and doing the same kind of commute for several hours on the way home. Obviously, safety consequences there for people who are worried that they may be involved in road traffic accidents, and again, something that we're very happy to take reports on. Crucially, in terms of talking about these issues, and perhaps the reason why we get to hear about some of these at CIRAS, is that only 33% would feel comfortable discussing a mental health problem with their employer. And the reason perhaps is that if they do discuss that, they feel they would be stigmatized. And there's actually evidence to suggest that would in fact be the case. When people do bring up mental health issues, what often happens, unfortunately, even now, 21st century, with workplaces as they are, they do get stigmatized, people do get labeled, and it becomes difficult after they've brought up an issue like that. One statistic which I find quite incredible: 1 in 4 people will experience a mental health issue in the UK. Now, when you think about how that has implications for the workplace, you look around, you think about your immediate team. This is going to apply to somebody in your team. 1 in 4 will experience a mental health problem. How many of your team actually bring that up or would feel comfortable bringing that up in the workplace? All sorts of symptoms that people experience. As you can see on the right, some of the things that people will talk about that can be symptomatic of something else, a headache, anxiety, depression. People are very afraid of bringing those issues up, even now. And that's very much a cultural thing. In the States, perhaps people are freer to talk about those things and wouldn't mind saying, for example, that they were seeing a counsellor. We don't have that kind of culture over here, unfortunately, and many of those problems go unnoticed until it becomes an issue in the workplace. And for reasons that we've discussed, the accident, Germanwings, you can see that if we're not discussing those things, it does become quite tragic in certain cases. When you break down those issues, what sorts of mental health issues are people talking about? Per 100 people, you can see that those 1 in 4, those issues there, what are they talking about? Mixed anxiety and depression, almost 10 out of every 100. If they've got a mental health issue, it would be in that field. Anxiety, slightly less, 4.5, 4.7. Post-traumatic stress disorder, depression, phobias, eating disorders, panic disorders down at the bottom there at around about 1 for every 100. So the most common is this sort of bundle of things, bundle of symptoms, mixed anxiety and depression. And you can see that that is very much a sort of catch-all which people experience and quite regularly too. And that will be something that affects their ability to do their job in their workplace. Some more statistics for you. Another article, which of course you're free to follow up after the presentation. This was in The Guardian only last week, and it was called "The Culture of Silence Around Mental Health in the Workplace," and talking about how that culture really needs to end, which is really a message we're trying to echo here.
So, Chris, someone has popped up and asked us a question here. So can we clarify what OCD is?
Obsessive compulsive disorder. So this might be the sort of illness, for example, where somebody does something repetitively and obsessively. It might be that they have to wash their hands hundreds of times a day. It might be that they need to touch a door frame and keep on touching it, and they never get to the point where they actually feel satisfied that they've done that enough times. So obviously a very tough condition to live with, a very real condition for those people that actually experience that. So thanks very much for that question. It's a good one. Please do shout out if you've got anything else like that as we go along. So back to the article, Culture of Silence Around Mental Health in the Workplace. 75% of people, it was reported here, of 20,000 workers surveyed in this working age group 16 to 64 said they had experienced symptoms of poor mental health. So that's a huge figure, 75% of 20,000 workers, that is, just to reiterate that. For nearly 2/3 of those people, work was a contributory factor in giving those symptoms, in helping to create those symptoms in the first place. A reason why we should not turn a blind eye to any of this is that mental ill health is the leading cause of sickness absence. 15 million absent days attributed to stress, anxiety and depression in 2013. Cost it up, that comes to £8.4 billion. On the reverse side of this, not thinking about absenteeism, but presenteeism, that costs the UK economy a huge amount of money as well, £15.1 billion there. That's showing up at work, staying at work, doing far too many hours just to prove that you are there, and probably not being very productive at all, but feeling like you really have to be at work because that's the culture that is present in the workplace. 63% of managers actually feel obliged to put the interests of their organization above team well-being. Actually quite staggering again, 63% say that when it comes to the crunch, they need to put the organization above team well-being. Now, these are the people that are working as productively as they can for the company, but when business priorities take precedence, this is an issue. Coping with stress. It's not all bad news. There are things that you can do about some of these symptoms that can lead to mental health illness. Professor Kerry Cooper is a professor of organisational psychology and health at the Lancaster University, and some of the useful tips he provides are letting go of things we can't control, learning to say no, talking it out, perhaps through counselling, and exercise and meditation. So in many ways common sense, but we all forget to do these things when we're actually under pressure. So rather than me say too much about that, we thought we'd show you a short video clip of Professor Cooper talking about some of the things that you can do to help when the pressure seems too much.
Stress can be managed. It's about gaining control. The thing that causes people the most stress in life are all the things that happen to them where they feel they have no control over them. There's a variety of sources out there, of help out there that you can get if you're having problems, and you should go to them. You can cope with stress by going to friends and talking about problems. You can go to your GP and talk about it. You can go to their counselors. You can have many more counselors and GP practices than ever before who you can talk to. If you don't feel you have a friend, you can talk to that particular problem about. The worst thing you should do is think you can solve it yourself and do nothing and just sit and worry and keep it internal. That's the worst thing you can do. It'll damage your health and it won't solve the problem. Exercise is really important because it kind of puts everything into perspective. So if you had a really stressful day at work, which usually spills over to the home environment if you then go directly from work to home, it's always best, I think, to go off to a gym, go swimming, do some kind of exercise, because it does the break. It puts life into perspective and say, that's one part of my life, but home is another part, and I'm not going to let that spill over there. It also makes you think more clearly about problems you have, because you're chilling out, you're relaxing by exercising, and it makes you then think through the problems you have and the solutions to those problems. Relaxation techniques, whether it's meditation or yoga or whatever the relaxation techniques, can be helpful. It can help you get into the frame of mind of looking at your lifestyle, your issues, the stresses in your life. So it can be very, very useful. And there's a variety of these kind of techniques, from actually kind of formalized yoga, meditation techniques, or it could be just a relaxation exercise, which you can do like for 5 or 10 minutes by going to a quiet place at work or in the home, and you kind of relax and you think about something that you find peaceful. You can think about being on the beach and hearing the waves splashing, or just lying in a field somewhere and just unwinding and just thinking about things that make you feel good and peaceful. So if your problems are a blocked career at work, a bad relationship at home, the relaxing and meditating is not going to solve that problem, but it might get you in the frame of mind to think about potential solutions.
For more information, visit www.nhs.uk.
Okay, so in many ways, the heart of our presentation in talking about the links with confidential reporting, and there are some strong links to be made. When our hot phone line rings, first thing to say is, in order for us to progress the report, it has to be about safety. So it's worth making that point that CIRAS is not in any way a counselling service or set up to handle mental health issues. However, it's a very valid thing to say that somebody phoning into us may well be anxious that their safety concern, if it's left unaddressed, will affect their mental health. And there's very often a concern that if safety issues are left unattended, the likely result will be an accident, and that's often on people's minds when they actually contact us in the first place. Second thing to say is that the subject matter of our reports very often can create mental health risks further down the line. So a common theme in our reports is fatigue. In actual fact, when we ran the statistics the other day, 13% of our reports actually carry the risk of accident through fatigue. And the sorts of issues that come up are fatigue on engineering sites, driving to and from work, and this is across different transport sectors too. It can apply as much to train drivers as it does to bus drivers. You can see there at the bottom, if you'd like to follow up later, we've actually produced a video on fatigue. It's a video of about 9 minutes long, and it's targeted at shift workers, describing some of the influences that can lead us to being fatigued and what to do about it as well. On your right there, we've been using this in quite a bit of our presentation material, the exhaustion funnel, from a researcher in Sweden called Marie Asberg, and she's nicely encapsulated what can happen if we don't attend to those symptoms when they first arise. So you've got things like sleep disturbance, irritability, and as you can see, as you move further down that spiral heading towards exhaustion, there's joylessness and hopelessness there, and these are the sorts of things that catch up on you. You think everything's okay, you go on, but you actually find yourself in a position of burnout further down the line. And it's relatively easy if we don't check ourselves quite regularly, and we sort of check in on how we're actually feeling and what our mood is, for those things to actually lead to that point of burnout further down the line. So it's something that we can all sort of pay a bit more attention to. And obviously for people that are reporting those issues where fatigue is a larger factor, this may be more of the case there. If you're driving long hours to a site and you've got an issue at home, a domestic issue, obviously all of those things can help you reach that that point a lot quicker, and it's not good for anybody, certainly not good for people in safety critical roles. We started to take reports which actually do target the issue of mental health. So fairly recently, we had a report which was specifically about the support given to employees who suffer from mental health issues. And the basic points that this reporter was making was that the workplace support was said to be inadequate. It didn't feel as though there was enough support for people with conditions like stress, depression, or even suicidal thoughts. And what they were really saying was they needed more help and guidance. Now, there is an issue here in that if you are feeling particularly isolated or depressed and fed up, you are less likely to ask for help in the first place. So some organizations do a terrific job of actually providing those support mechanisms for their staff. But when you are actually feeling very, very low, it's more difficult actually to reach out and get that support as you need to. And perhaps it's then incumbent upon the organization really to think, how do we do that? How do we actually bridge that gap so people can actually feel that they can ask for help when they're actually feeling that there's no one else out there who will help them? In terms of another thing that we can actually use as a coping strategy, mindfulness has become a very popular topic over the years. It's been applied in all sorts of sectors. There's a lot of press on it for schools, in the corporate sector. In terms of defining it, John Kabat-Zinn, who is one of the main figures based in the United States, has encapsulated it fairly well here. The awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding of experience moment by moment. And for anybody interested, he's written a very long book, but a good book, Full Catastrophe Living, which goes into that in a lot more detail. It's also got implications for safety and operational performance, and those are some of the things that we'll be focusing on in the next few slides. So this for me is quite a groundbreaking study. This particular case study that I'm talking about here happened in Catalonia. So it's an operator, FGC Catalan, public operator of urban, suburban and regional lines, actually carry 80 million passengers a year. And they identified some of the factors affecting the operational performance of drivers, and those factors affect drivers all over the place. Driving trains, also similar conditions for bus drivers as well sometimes. So the nature of the work: solitary work, limited social interaction, monotony, tasks that are repetitive, and stress of that working environment. So they identified their fundamental requirement here, which was to prevent the loss of attention and for their drivers to stay alert, a very basic thing if you're driving a train. So what did they do? They chose a particular program based on John Kabat-Zinn's work. This is the Mindfulness-Based Stress Reduction Program, or MBSR, as it's said in shorthand. So they actually advertised and took 23 drivers onto this program. It was a custom designed program that was based on getting them to pay their full attention to the task at hand. So as I mentioned, it was John Kabat-Zinn's program. This goes back a long time. Lots of research into this area, goes right back to 1979, and the work that he started in the University of Massachusetts in the medical center there. So in terms of goals for that particular study, they were looking to develop more resilience in their drivers, help them cope with stress, just be more present, which is a fundamental thing in mindfulness, and to avoid being on autopilot. In terms of the results, actually quite incredible what they were able to achieve here, and 85% having taken that custom-made program said that their attention was higher or much higher than before the course. And as you can see on the graph here, they'd had a number of operational incidents leading up to that mindfulness course. And admittedly, we're talking about a fairly small sample of drivers, and we're not talking about a whole load of incidents. But you can see on the left of that red line, the red line represents the mindfulness course that these drivers took, those 23 drivers. Those operational incidents represented by the black dots, SPADs, or station overruns. You can see, for example, that in 2014, they had 11, if you count them up, 11 operational incidents, quite serious incidents that have consequences for the drivers involved and also have cost implications as well. So in the run-up, quite a few incidents there. After that mindfulness course, absolutely no incidents at all for 6 months. Admittedly, that's a short period of time, and I believe there's going to be follow-up work to actually see if that benefit was sustained over time. But if it was, if it is, and we'll await to see what the results are, that's quite incredible to actually remove some of the possibility of having those incidents in the first place. So the benefits for the drivers there, having been on that course: improved concentration, emotional regulation. They were better able to regulate their own emotions. They were more resilient, and they were effectively given coping strategies for managing stress and fatigue. Obviously, that has huge benefits for those drivers in their work lives and also at home as well, and feeds through into better operational performance. So when we look at mindfulness and we forget this image that we may have of somebody floating around and meditating, in terms of a very key concrete benefit, it brings it home when you actually look at the cost of having incidents. So in the rail industry, we're very fond of talking about signals passed at danger and the implications of those. The actual cost of having a signal passed at danger has been estimated by the Imperial College in London at being £29,000. You can see the link there on the right-hand side if you'd like to follow that up at some point. But it's hugely expensive to investigate, get drivers working again, and also if drivers are dismissed, hugely expensive for the company involved. The cost of mindfulness training, that MBSR program that we're just talking about, for one driver was £400. When you cost it up, that £29,000 would train over 70 drivers for the price of a single operational incident. So if we were able to do that in the UK rail industry, as they did in Spain, that would be quite a phenomenal achievement. So there are very obvious implications there for enhancing safety culture. It's got applications across all transport sectors, and just something that perhaps we should be doing more of. To link in with some of the very good work that the RSSB, the Human Factors team there are doing, non-technical skills, it is very, very linked here. Just to give you some background on non-technical skills, there's a nice definition there. NTS have been, or non-technical skills have been defined as the cognitive, social and personal resource skills that complement technical skills and contribute to safe and efficient task performance. And non-technical skills such as situational awareness and workload management are defined as key contributors to good performance. And you can see some of the work here represented in those categories. This is work that the RSSB Human Factors team have done there. So situational awareness, you've got key components: attention to detail, retaining information, maintaining concentration, that global awareness, and the anticipation of risk. And in many ways, this is another way of talking about mindfulness, but used in the language of non-technical skills. It's pretty much the same thing, just coming at it from a slightly different angle. To make some other links with organisations that are also working in the field with links to mental health. Some companies that we've had some working with before. Staff Absence Solutions, for example, specialises in the management of fatalities and long-term absenteeism, and they're doing some very good work there in supporting employees following traumatic rail-related incidents. You can find out more there at staffabsencesolutions.com. And another company that we've been working closely with recently, from building site to boardroom, they're doing some good work there in organising training courses for the construction sector, highlighting the benefits of a more mindful approach in the workplace. And obviously, if that comes to pass, that people are more mindful, it vastly decreases the chance of having an accident. So it's really just to sort of make that point that some of the tools here that we suggested in coping with stress and using mindfulness are actually applicable in the transport sector and beyond. So just like to say thank you very much for listening and paying attention there. You can find out more about CIRAS and our links with other organisations. You can get the latest intelligence from confidential reporting there at www.ciras.org.uk. Our latest newsletter is now available. You can download that, and it's highlighting 20 years of confidential reporting, which is how long we've been in business now.
Yep, just to add, we're also here on behalf of the IOSH Railway Group. Please head over to our LinkedIn page and our subgroup, which is you can go on the IOSH website, and then if you go on groups, you can go on the Railway Group. We've got lots of good information on there for you. If any of these topics really interest you and you want to know more, please get in touch with us. We're always looking to host new events as well. So if you've got a venue that you want to help us organise an event with, please just get in touch and let us know. We've got our conference next month in November that we're holding in Nottingham, so I hope to see as many of you there as possible. Thank you.
Okay then, well, thank you very much to Chris and Amy for attending today and delivering this session. There haven't been any other questions that I can see of, so which in my eyes suggests that the presentation was that good that there were no questions were needed. So I'll leave the chat open just for another sort of 30 seconds or so, just in case there are any last minute questions that come in. Otherwise, I'll be closing the chat very shortly, and I hope you enjoyed the session. I mentioned earlier that the session has been recorded, so a copy of this recording and the presentation will be made available to you all as well. This will be put both on the Railway Group's microsite, and I'll also email it out separately to you all. So thank you all for attending, and we have had one question come in. So the question here is what legal obligations currently are in place for managing this?
Well, I have to say that, on the legal side of things, I'm not an expert on this, so I'm not able to answer that, but that's perhaps something that we can actually follow up for afterwards. So thank you very much for asking that, and we'll endeavour to answer that for you in slower time.
Okay, great. Another question just coming about the links of the presentation being available. I believe they are. When the presentation gets put out, the links will also actually be within the PDF, so there should be hyperlinks which you can just click directly onto to access all of the sites. I think that looks like it's it. Oh, we have had another question come in. Where can I find information on mindfulness?
Right, good question. I think there are so many YouTube videos out there with Jon Kabat-Zinn which are worth researching. There is a book called Mindfulness, Finding Peace in a Frantic World, which is by Mark Williams, who's a notable figure in the UK. So I would suggest really that you go for either of those, Jon Kabat-Zinn as one of the founding figures, and then Mark Williams for the UK version of mindfulness, if you like, but there is plenty of material out there if you Google it, but those two books really are a good place to start if you want some reading. So Mindfulness, Living in a Finding Peace in a Frantic World, and Full Catastrophe Living by Jon Kabat-Zinn. So hopefully those will give you a heads up on mindfulness.
Just to add the question that was asked about the legal obligations, obviously organisations do have several legal obligations to their staff to look after their health and well-being as well as their safety at work. And we've had a few people just reiterating here that they have obligations under the Health and Safety at Work Act and also the Management of Health and Safety at Work regulations. So that is something that you can look up more. If you want to look on the HSE website, there's more information about those legal obligations there. Chris, we've had a couple more questions come in. So we've been asked, is there a stress test template we can work off?
Sorry, a stress
test template.
I think that's something that I'd have to have a look into. I'm aware of various stress measures which are really self-report questionnaires, which is one way of measuring it. And I'm aware that you can do that through other means as well, but again, that's something that we could perhaps research and provide you some feedback on in slower time. So thanks, good question. There are various ways of doing that we can perhaps provide some feedback on.
If we have a go at answering as well, we've been asked, how would you deal or report any stigma related with reporting of stress related illnesses? So obviously that is something that we can report through CIRAS. I mean, we deal with health and safety concerns. So if, there is a stigma still these days attached to mental health, and that's why we're doing this today, people can report these things to CIRAS. I mean, we're not trained counsellors like Chris said. So, if you really want to discuss any mental health issues that you're experiencing, we're probably not the best people to deal with those, but if they're leading to health and safety issues in the workplace, like we said, you can report those to CIRAS. Give us a call. It's all completely confidential. If you don't even want to make a report, but you just want to run it by us, you can always give us a call on our hotline number. That's on our website. I'll just reiterate, it's 0800 4101 101. We've also been asked, Chris, have you any further information about successful organisation mental health strategies or interventions?
We are actually aware of some of the mechanisms that Network Rail have put in place, and they seem to be class leading, and we have actually been provided with a copy of some of the things that they actually do for their staff. So that's also something that Network Rail perhaps are quite happy to provide to us, and we could circulate afterwards. But there are ways of doing that and supporting staff and doing the organisational utmost really to actually make sure that staff can actually reach out and get the help they need if they know where to get it. So I think that one of the things is that staff need to know where they can actually find that information in the first place.
Great. We've also had someone comment, one of our delegates has asked us, they have safety stand-down days. Are we available to deliver the same or similar presentations? The answer is yes, we'd be perfectly happy to. Please just get in touch with us. You can get in touch with Chris or myself. Have we got our email addresses on here?
I don't think we publicise them here, but Amy, you can say yours in a minute. Mine is just chris.langer@ciras.org.uk, but of course we can make those available afterwards as well.
Yeah, and you can contact me. It's Amy, AIMEE.Skelly, SKELLY -Burgess, BURGESS @ciras.org.uk. Bit of a mouthful, but yeah, please get in touch with us. We'll be more than happy to come out and work with you further on this.
Okay, great. Well, it looks like we've now answered all the questions. So on that basis, I think we'll call it a day. Again, thank you very much, Chris and Amy, for coming in. The session will be posted shortly, and I will be in touch with you all. Have a great afternoon, and thank you for attending. The session will now close.